This lecture talks about antibiotics. A patient comes in with a bacterial infection. You send a sample down to the lab and it comes back as being a gram-positive rod. Treat the patient with penicillin because it is known to be effective against gram-positives. Unfortunately, the antibiotic did not work and the infection is beginning to spread. So the doctor orders an antibiotic susceptibility test in order to choose a more appropriate antibiotic to treat the patient with. Why did you choose penicillin? Why is it more effective against gram-positives? What are the next steps to control the infection? These questions will be explored in this lecture. In lab, we're going to perform an antibiotic susceptibility test on various species of microorganisms to determine which antibiotic would be best to use for infection with that species. So, some principles of antimicrobial therapy. Characteristics of the ideal antimicrobial drug. Now, to start, the ideal antimicrobial drug does not exist, because there's no one drug that meets all of these requirements. But we're going to talk about what these mean. So selectively toxic to the microbe but non-toxic to the host. So when we take an antibiotic, we don't want to kill ourselves, we just want to kill the pathogen. Microbicidal rather than microbistatic. If you remember the difference from the growth lecture, cidal means to kill, static means to prevent replication. So we want an antibiotic to actually kill it, not just slow it down. Relatively soluble, functions even when highly diluted in body fluids. For those of you going on to take a pharmacology class, you're going to learn about how drugs are processed in the body. But if you think about it, you swallow a pill, the pill gets broken down in your stomach, and then it gets absorbed across the stomach lining into the bloodstream, and then now it's traveling in 5 liters or so of fluid around the body. And eventually it has to get its way deep into your tissues where the infection is actually going on. So through all of that process, and even the digestive processes, we can't have this drug getting broken down or diluted too much. It has to be able to float through the bloodstream. So there's a lot of things to consider when designing an antimicrobial drug. It remains potent long enough to act and is not broken down or excreted prematurely. We'll talk about artemisinin later on. It's an antimalarial drug, and that one gets excreted prematurely. Within a couple days, all of the drug is out of your system. So it has a very short half-life, meaning that half of the drug has been metabolized or used up or excreted from the body in a very short period of time. So most drugs are going to be excreted through the urinary system, and we don't want that to happen. We want it to stay in the body long enough so that it can actually do its job. Doesn't lead to the development of antimicrobial resistance. There's not one drug out there, to my knowledge today, that one organism in the world is not resistant to. So every drug, there's resistance to it. Complements or assists the activities of the host defenses. So the host defense is the immune system. That's what we're going to talk about next week and then the following week. But we want a drug that works with our immune system. Remains active in tissues and body fluids, so that kind of goes along with what I talked about with the drug being absorbed into your bloodstream. Readily delivered to the site of infection. Reasonably priced, and does not disrupt the host's health by causing allergies or predisposing the host to other infections. Predisposing the host to other infections. That's a huge one. So when a patient goes on antibiotics for a long period of time, what can happen is their natural bacteria can get wiped out by that antibiotic. When their natural bacteria goes away, it causes an overgrowth of opportunistic pathogens. That's a huge issue, because the opportunistic pathogens were probably always there, or at least there for a long period of time, but they were kept in check by the good guys. Once you wipe out the good guys, the bad guys have an opportunity to overgrow. And it's a really delicate balance to try to get the good guys to regrow. That's where probiotics come into play, and we'll talk about probiotics in the next lecture. So some definitions. Now these definitions are all completely written out for you, but I'm just going to go through them briefly. So a chemotherapeutic drug. Chemotherapeutic. Chemo is chemical, therapeutic, therapy. So it's any drug that's used to treat anything. So it's not talking about just antibiotics. Any chemotherapeutic drug could be like a blood pressure medication, a beta blocker, antihistamine. So any type of drug that's used in the treatment, relief, or prophylaxis of a disease. So prophylaxis. Prophylaxis is the use of a drug to prevent imminent infection of a person at risk. Let me give you an example of prophylaxis. If you get bit by an animal, a wild animal, and you think that that wild animal has rabies, but the animal ran away, so you didn't save the animal's not dead, can't send its head off to the testing agency to see if it was positive for rabies. You just suspect that you've been exposed to rabies. What you do is you go to the hospital, and what they'll do for you in the hospital is they'll open up the wound a little bit, they'll flush it out and clean it as best they can, but then they give you the rabies vaccine. Now, something unique about rabies is that it has an incubation period of 1 to 2 months. What that means is when the virus enters into your system, it's not really going to show any signs or symptoms for 1 to 2 months. So, if a person's been exposed to rabies and we give them the rabies vaccine on the first day of exposure, their body will build up a very strong immune response against rabies, so that by the time the rabies virus has replicated enough to show symptoms, your immune system is primed and ready to wipe it out before you ever show symptoms. You're a person at risk. You were exposed. But now they're giving you a drug to prevent infection. Antimicrobial chemotherapy, so that's the use of drugs to control infection. Antimicrobials are any type of drug that's used to target microorganisms. Antibiotics are substances produced by the natural metabolic processes of some microorganisms or created by scientists that can inhibit or destroy microorganisms. Antibio. Anti is against something. Bio is talking about life. So that's a compound that was produced by a living organism that's used to kill off another living organism. If you think way back to the beginning of the semester when I showed you that picture of the rotten carcass on the beach, and I said that bacteria and fungi are competing against each other for that rotten carcass, and they started producing these antibiotic compounds to fight each other off, like mini weapons that they combat each other with. That's what an antibiotic is. So it's an actual chemical that's produced by a living organism to fight off another organism. Now we have different derivatives of these antibiotics. So the first line, or the first generation, those were all discovered in nature. And they did this huge screening procedure and went out into the forest to try to identify different types of antibiotics. And they went into like exotic jungles and everything. They mentioned that a little bit in the streptomycin video. So if you guys watch those introductory videos, then you should have learned a little bit about that. But then resistance developed. So the microorganisms were no longer responding to the antibiotics, the first generation of antibiotics. So what scientists did is they chemically modified them slightly to make them a little bit different. That's what a semi-synthetic drug is. So drugs that are chemically modified in the laboratory after being isolated from natural sources. So basically they took an antibiotic, changed it around a little bit, and now you have a semi-synthetic drug. Synthetic drugs are produced entirely by chemical reactions within a laboratory setting. So with a synthetic drug, we used a model from nature, so in the back of our mind we're like, oh, this used to work, so let's develop a compound that kind of resembles this. But we did not use any component of the molecule that was isolated from nature. So synthetic, 100% made in a laboratory. Semi-synthetic, we took the natural compound and modified it a little bit to make it a little bit different. This is where you have all your first, or your second, third, fourth, fifth, and so on generation of antibiotics. Narrow spectrum versus broad spectrum. Narrow spectrum targets very few organisms, so it's extremely specific in what it can kill. Broad spectrum targets a wide variety of microorganisms. Which one's better? So a lot of people think that broad spectrum antibiotics are going to be better because, you know, if you don't really know what's making you sick, if you just wipe out everything, then that has to be good, right? It's actually not true. So narrow spectrum is better. You should diagnose the infection, know what you're dealing with, and then treat it with the antibiotic that was designed to kill that specific microorganism. Narrow spectrum antibiotics prevents the development of resistance, and we'll talk about antibiotic resistance at the end of this lecture. So here's a spectrum of activity. So you can see tetracyclines here have the broadest spectrum of activity. There's a lot of resistance against tetracyclines now, and they have some benefits for a lot of microorganisms, but they also wipe out the good natural flora. So that's kind of a dangerous one to use long term. There's also side effects that come with that one.